You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey vet rehabbers, today I'm joined by Laurie McCauley. She is one of the forerunners in the field of veterinary rehabilitation, having started her practice in 1998. She was also instrumental in the start of the Canine Rehab Institute, and she was one of their first lecturers educating vets, physios, and vet techs with the certification in veterinary rehabilitation. Laurie is also giving a presentation to all the vet, physio, and vet tech students attending the Vet Rehab Summit this year. It's on the 14th of November, and it is one day. It's an online conference, and she is going to be presenting on how to get into the field of veterinary rehabilitation. So if there are any listeners out there who listen out of interest to the Veterinary Rehabilitation podcast, but you're not yet certified as a vet rehab therapist, you don't want to miss Laurie's presentation. Laurie chats to us in this podcast about laser therapy, a topic she is very passionate about. We chat about some mistakes people make when choosing a laser and what we should be looking at first before making these decisions. We also touch on some of the contraindications and times when you should be cautious using this modality. She has developed an online course which is available on her website, optimumpetvitality.com, and she has kindly given all of the listeners a $50 discount to the course. So you can use the code OPVOPH, all uppercase. I'll repeat that, OPVOPH, uppercase, and I'll put the links to this course in the podcast notes. Before we head over to my interview with Laurie, a quick word from our sponsors. Choosing the right therapy, laser, and PEMF systems for your practice are big decisions, and that's why Response System has been helping to make that decision easier for over 35 years by offering both Class 3B and 4 lasers, as well as a full line of PEMF products designed for both small animals and horses. All their systems are also fully rechargeable and adapted for all international grids. And you can find out more at responsesystem.com. You can also come and chat to the Response Systems team at the Vet Rehab Summit on the 14th of November. So over to Laurie. Hey Laurie, thank you so much for joining me.
Hey Meg, good to see you. How's everything going?
Yeah, all good here in South Africa. Laurie, won't you, just for the listeners, just tell them a little bit about yourself and how you got into the field of veterinary rehab?
Well, actually, when I started, there was no field of veterinary rehab. I got out of vet school, and you know how you start, and it's like everything's exciting, and then it was like one exciting case a week, and then one exciting case a month, and then I was bored. And I had a burning desire to learn. I felt really pulled to learn acupuncture, and I went to my boss and he said, I don't believe in it, I won't give you the time off, and if you do it, I won't refer to you. So it was very much a hard line in the sand. And at the same time, my sister-in-law, who trains police dogs, said, hey, if you're going to learn acupuncture, can you take a course in like physical therapy and find out what's going on with all these working police dogs so we can keep them on the force? And I said, sure. And there was no course. So literally I left my position. I had a new son. Things in my life happen, some people say they're like led on a course. I was shoved through this course. The only place that was doing any kind of physical therapy was Alameda East out in Colorado. And I called up Bob Taylor and I said, hey, can I come and spend a month and intern with you and just learn everything I can? And he said, I never take interns, but for some reason I will. My mom lived 5 miles away. So she watched my 6-month-old son, and I spent 12 hours a day learning everything I could. His PT had actually left, so he had a new person in. So we were both learning, going through working with the dogs. And from there, I came back. I started my place, and a year later, I learned chiropractic. And this was like a tiny little place. I had like an underwater treadmill, which I designed, the first one. And then it just grew, and I was only going to work 3 days a week, and it just exploded. And then my underwater treadmill worked really well. I mean, I was taking paralyzed dogs, taking them to walking. So when they had the first international symposium, I made a poster, and I took it. And at that point, Jan Van Dyke said, hey, you lecture pretty good. You want to come lecture for CRI? And that was in 2004. She had just started, and I lectured there for 14 years, created a big new facility there were 4 full-time vets, 3 full-time techs. So we had the first rehab center anywhere in the world. And it just exploded from there.
Sure, yeah. So 2005 was when I was at the University of Tennessee doing my CCRP. So it was literally just like a year afterwards. I know, because in those days, rehab really wasn't a thing, right? Like, I mean, I got into the field of rehab through an article that I read by Laurie who's a UK vet. And I remember, even in the UK, there was nobody doing it. It was such a new field. And I remember speaking to all my colleagues and tell them I'm flying over to the States this is what I'm going to be learning about. And they were like, what is that? So it's amazing how far the field has come since then. I mean, there's been massive changes, right? In the last 16 years in the field.
Well, and think about this. I started in 98. Right?
Yeah.
So I was doing it for a long time. When I had the first underwater treadmill, I had to literally buy a human one and figure out how to attach it to a jet ski lift and crank it to get into the pool that I designed, because there was nothing.
Yeah. So we can chat about rehab, lots of more stuff, but we're actually here today to chat about lasers, right?
Yes.
So this is something that really interests you. And you and I were chatting, and I thought, this is a great topic, something that we can actually chat about, because there's so many things that people they're not sure about. Like, I mean, there's the obvious one, like a class 3B laser or a class 4 laser. So let's start with that. Like, is the stronger the laser, the better?
It's a great topic, because honestly, it's one variable, right? And there's other variables. So wavelength is just as important as power. And if you have the right wavelengths, class 3B is great. And if you have other wavelengths, you need a class 4 to get your penetration. It depends upon if you're using continuous versus pulsed. There's a lot of different variables. And I think both class 3 and class 4 lasers are great. There's even class 1 lasers out there that in the research have effects.
Yeah. So, I mean, the question always comes, especially in the Facebook groups, is like, I want to buy a laser. Which one should I buy first? So what would you recommend?
Honestly, it would be depending upon what you want to do. So again, if you lived in the country and you had a farm, a Ferrari would be a really bad thing for you. If you lived in the city where there was no parking, a big dually truck would be not good for you. So it kind of depends upon what you're looking for. Again, all the lasers have results. Some of them are different, and it kind of just depends upon what you're looking for. So there's not one best laser.
Yeah, so like, give us some criteria. Like, so if you're a small animal vet rehabber and you're treating, what type of cases you would recommend then to go class 3 or class 4?
It's not class 3 or class 4. Honestly, I will go back to its wavelengths. If you treat derm and acupuncture, you need something in the 600 range. If you're going deep, you're going to either use like a 980 with a lot of power or a 904 with a lot less power. And if you want to decrease inflammation, something in your 800 range, that's where you don't have the absorbance of water. So you can have your penetration and you can get through the tissue that way.
Okay, so because everyone always asks, which class should I get? And I think it comes down to the fact that the class 4s are generally more expensive, right? Than the class 3Bs. And so people think like, should I just go for it and invest the money and get a class 4? Or am I okay just to get a class 3B laser?
They all have effects. It just depends upon how you use it.
Yeah. So what are the most common mistakes that people do when they're using this modality? What are the common mistakes that you see people when they're treating patients using laser?
One of the big things is not knowing your goal, right? If you just say, I'm just going to laser everything and hope something works. So you want a high dosage if you're trying to basically create an axonal nerve block, so stop pain, versus a low dosage if you really want to stimulate healing, right? So there's studies that show that high doses stop fibroblast activity. They stop ATP production, which in a nerve is good if you're trying to block pain, but not as good if you're trying to speed healing.
So for vet rehabbers, what are the most common conditions that they would be treating if they were
Wait,
using?
I have one more for you. Really
Okay.
important. The number one thing that people make mistakes on is
Yeah.
they don't aim for their tissue. So
Okay.
if you understand your anatomy, it makes a huge difference, and it takes so much less time and so much less energy if you get to the tissue that you really want to treat and not just shoot and wave over everything. Because, I mean, if you do that, that's fine, and you're going to get energy into the tissue, but if you're specific, you get a much better result.
So when you say specific, you're actually, and that comes to the goal, right? So you have a goal of what tissue you're actually trying to cause a reaction in, instead of just saying, oh, I'm generally treating this area. Yeah. Okay.
Yeah. Give you an example, cervical vertebra, right?
Yeah.
If you can treat, I mean, I've seen people treat from the top. You're going to have no penetration no matter what laser you do. You're going to make the muscles feel better, but you're certainly not going to get through this much muscle and then through the bone, right?
Yeah.
Or going straight over the dorsal spinous processes, you got bones sticking up like that. But if you know, okay, I want to go in through the intervertebral foramen, right? In the neck, I can't even really get through the lamina as well. And I know how to get to it and how to manipulate the body to get to it, I'm going to have amazing results. And then use tiny doses over the muscle because that's really all they need. Takes a lot less time and a lot better result.
So be more specific about your treatments, where you're going in, what sort of areas that you want to treat.
Yeah, huge. Even the fact of flattening out the joint capsule, so going from convex to flat, is going to give you better results because it's the cells on the inside that we want to treat.
Interesting. So what are the type of conditions that we would be treating using laser?
Oh, everything. Anything with an itis. So everybody thinks about osteoarthritis, but it could be otitis, right? I can get the whole horizontal and vertical ear canal in the bulla. It could be pancreas. It could be liver, kidneys, certainly any kind of dermatological abrasion, wound, acupuncture points, obviously all of your arthritis, any kind of tendinopathy, anything with an itis.
Yeah, so I mean, if we look at lasers, obviously veterinary practices can use lasers, and then vet rehabbers would use lasers. So all these sort of pancreatitis and things like that. I mean, I've never used a laser to treat that because I'm primarily in rehab now. So that's quite nice for the vets, but obviously you do need to be trained.
Absolutely.
Using this, yeah. So where would a vet go to get trained? So let's say there's a vet that's not specifically wanting to use it for veterinary rehabilitation. So they just maybe listening here and they're wanting to get some better training on using laser and incorporating it into private practice.
Well, if you've gone through the rehab courses, you get some training, right? So if you've gone through CRI or the Healing Oasis or the University of Tennessee course, they'll give you some, but actually I have just produced a laser course that is available on my website at optimumpetvitality.com that goes through everything from all of the research and all of the how to use it, when to use it, what you need to know, as well as, hey, let's look at a knee. This is how I'm going to treat the caudal aspect of the patella, right? So the minute details that'll give you significantly better results, as well as if I have a liver that I want to treat, what's my positioning, what wavelengths do I want to use, how do I use it with multiple different companies. So I have 4 laser companies that are sponsoring it. So we go through with all of those, what's the best way to treat each area.
Awesome, thanks, Laurie. We'll, for the listeners, I'll put that those details, the URL, in the show notes. So if any of you are interested in that, we can have a look at that. And then I'm thinking about other things that people might want to know about, you know, thinking about lasers. So like, what are the things that would be contraindicated? So if you, like, what type of conditions would we be worried about when using a laser?
We do worry about with young animals, the thymus,
Yeah.
growth plates, right? We worry about, we know that if you give an injectable long-acting steroid, that lasering over it for even a couple weeks can create pain. But think
Mm.
about any other drug that you inject, right? So if I inject a vaccine even, and I
Yeah.
laser over it, especially if it's creating heat, we don't know if it's changing the metabolism of the body with that substance or if it's changing the substance. So that's a big one. And yet we can use it, like if I have, say I have a bladder infection, I can give oral antibiotics and then laser over the bladder knowing that I'm increasing blood flow to bring the antibiotics to it. But over an injection site, that's definitely a, a contraindication. Cancer, obviously, yet, right? I've had patients where we used it as palliative therapy and give them up to 9 more months of happy, healthy life, knowing that the cancer might come back, but we save them all the pain for 9 more months, which is wonderful, which is, sometimes better than what you get with chemo.
Yeah, so I mean, those are cases where you know that potentially by lasering in that area, it's not going to be a good thing. You don't want to increase blood supply to a cancerous area, but you're saying to yourself, well, there's nothing much more we can do here, so we're not going to operate. We really just want to control pain. So although you could be making it worse, you're just basically covering that animal's pain and helping them just get through their last days.
Mm-hmm.
Yeah.
Or after surgery, right? If you debulk it and then they still can't control the pain, that's another way to do it. Yep.
Yeah, I mean, is there concern that maybe there is a few like cancerous cells left there?
Mm-hmm. Oh
So
yeah.
if you wait until like you got histopath results back first to see that it was clear, although even saying that there's a possibility, that there are a few cells there, and by lasering there, you could cause the tumor to grow back again.
I actually would try all my drugs first and
Yeah.
all my other modalities first. But knowing that that's something I can fall back on because I know I can get that axonal nerve block with enough energy to stop the pain.
Yeah. And then just touching on the growth plates again. So what is the reason for that? So
We don't
why would,
know. It's
yeah,
like pregnancy, right? We don't want to take a chance. So if it's going to make it grow faster or maybe close it early, we don't know. So we just stay away from them.
because we know it's obviously great in fractures and things like that. So people end up
Absolutely.
healing. So
Hmm.
maybe it just speeds up the growth plate and then it closes too early. I mean, have there been any cases reported from
There
using laser?
haven't that
No.
I've seen,
So
but
it's
again, it's just a generalized, it's like you don't
yeah,
laser over a pregnant, over
yeah,
a pregnant uterus because you don't
yeah,
want to do the study to find out.
yeah, sure. And then the thing about the injections is really interesting because if you think about it, sometimes, especially if you're a vet rehabber, the patient might have gone to a vet 2 days ago. And if the owner doesn't mention that they've had an injection, maybe a skin injection or something, a depot injection or something like that, you don't know. You could potentially be lasering. That's why it's so important always to get history from clients. Has everything okay?
Absolutely.
Any problems recently? And then they'll maybe mention, oh, yes, he's got a chronic skin condition, but we went for an injection. And then you can
Hmm.
obviously ask, yeah, to make sure that you know about that. And then
Absolutely.
what about something like if you had bleeding? So if you had an area where, there was bleeding, you'd obviously want to avoid using laser then.
Absolutely. If it's like a hemothorax, yeah, worry about that. Even oral hematomas. There's some people who have had good results on like 20 to 30% cases, but my general rule of thumb is drain them, tack them, and then laser them to
Yeah.
speed the healing. You just don't want to add, you don't want to add anything into it. And don't forget eyes, right? And yet, again, even though it's contraindicated to go through the pupil, um, with corneal ulcers, you can certainly use a LED light, either red or blue.
Yeah.
And some of the laser companies are now saying, well, if you don't shine through the pupil, it's okay.
Yeah. So do you use any of those other types of light
I
therapy?
do.
Yeah.
I can tell you from personal experience, blue LED is really good for poison ivy. Um,
Okay. Yeah.
yeah, and again, red and blue for eyes, for skin infections, or skin anything. There's
Yeah.
tons and tons of research showing for skin, red is amazing, and then different bacterias respond to different wavelengths. So some of them do really well or are more bactericidal with green, some with blue, some with red.
Okay. Awesome. Interesting. And one of the other contraindications I was thinking is the testes.
Yes. Again, though, right? We don't have any studies.
Yeah.
So, could you use it to increase sperm count if by using low doses? I don't know. If I had a really expensive breeding dog who had no live sperm and we weren't getting any better, would I try it? Oh, absolutely.
So I think it was,
With prior written consent.
yeah, but I think it's the heating, I think is the problem. So I
So
know
what
that,
wavelength and power are you using,
yeah,
right?
yeah,
If you
exactly.
use a 904, you'll never create heat whatsoever.
So there's people that do mountain biking. Yeah. So in
Mhm.
South Africa here we have a mountain bike race. It's called the Epic, and it's quite an interesting story actually. Is that the people that are doing mountain biking, guys, they basically found that they tend to have problems with having children, and they think
Mhm.
it's from the tight pants that they've got.
Mhm. Yeah,
So
yeah.
they're getting super hot down there. So yeah,
Mhm.
that's obviously one of the things that you're going to be careful around the testes, right?
Mhm.
So, Laurie, do you have any advice for any practitioner that is coming into the field if they are considering using laser? So, any other things that you would recommend?
Yeah, absolutely. I consider laser like a scalpel blade. So in the hands of a skilled surgeon, it's magical. And in the
Yeah,
hands of a 3-year-old, it can be disastrous,
yeah,
right? So it's not a toy. It's a tool that you need the education to use to the best of its ability. I know people who say, oh yeah, I bought this X number of dollar laser and it's sitting in the corner because they didn't have the training. They didn't have either results or they actually hurt somebody, and
yeah.
now they're afraid of it. And really, it's an amazing tool when used correctly. So education, 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 huge.
And so, have you heard of and seen cases that have been burnt, for example, by
Yes,
lasers? Have you? Yeah.
absolutely. I've had clients literally drive 3 or 4 hours to come see me past other rehab clinics because either their dog got squirmy and the person doing it, again, not the machine's fault. It's operator error.
Yeah.
Uh, they're like, my dog hurts. And they're like, oh, no, he's just squirmy. No, no, my dog hurts. Give me my dog. Or
Yeah.
smelling smelling the hair get singed. I've
Yeah.
seen um, burns, literally burns of the skin. But
Yeah.
again, that's not the machine's fault. It's like using a scalpel incorrectly,
Yeah.
right? It's not training, not understanding what you're doing. Or I've seen it where a technician comes from one clinic with one laser and is now working at another clinic with a different laser and think that they can use the same parameters with a different
Mm.
laser, and they're totally different.
Yeah.
So
So,
joules per centimeter square in one machine with one set of variables is totally different than joules per centimeter squared in another.
yeah, and obviously, the recommendations are, between 2 to 4 joules per centimeter squared, but there's other sort of articles and things that recommend even going up to 20. What is your feeling on that?
If you're in something in the 600 range, 2 is even kind of high. 1 is your absolute best. 2 is pushing it a little bit. 4 to 6 is like contraindicated.
Yeah.
Yet, if you have something in the 980 range, you're not going to get any penetration with that kind of dose. That's when you need a much higher dose. Your 980 is absorbed a lot by water, and it's not bad, it just is, right? So it means you have to saturate the tissue so you can get deeper penetration. The study that you're talking about was doing an elbow, right, the 20 centimeter or joules per centimeter squared, where they were actually literally trying to get into the joint through bone. So again, if you know your anatomy and know how to get up in there, you can use less energy, but you have to know your anatomy and what to do. You want to get to the joint capsule, you want to get to the cartilage. If you're going through bone, it makes it much harder.
And, most of the companies that you purchase these modalities from, do they offer training for their specific laser?
They all have something. So it may be just a book, they may have videos. A lot of them will have a short course with one of their sales reps, which will just be on the safety of cleaning it and all the OSHA requirements and stuff like that. But they usually have something.
Yeah.
But again, that's how to turn the machine on and get general guidelines. Or they may have more in-depth, depending upon the machine.
Yeah. So if we can break it down. So the first thing you're going to have a look at your machine is what type of weight, what wavelength it is, right?
Yeah, and that's huge. I mean, that's like saying I have antibiotics in my cabinet. Well, what kind do you have? I don't know. It's antibiotics. Well, is it going to treat ears or a bladder or an osteomyelitis? I don't know. It's an antibiotic. And yet so many people don't know what wavelengths are in their machine.
So once they know what wavelengths the machine has, then what's the next step for them?
Know what to use when, because a lot of the machines will let you choose, if you take the time to push the buttons, what you want to use it for.
Yeah.
So, if you're treating a skin issue, there's no reason to have something that's job is to heat the tissue, right? You don't want penetration. You want to have everything superficial. So again, knowing your variables helps you. It's like giving you colors to paint a picture.
And be clear on what your goal is.
Yes.
And what specific tissue you're wanting to treat. So
yes.
Be clear from the very beginning. Don't just go in there with your laser and just laser everything. Have a clear plan.
Yeah. Absolutely.
So, and one of the other things is what frequency would you recommend that the therapists do treatments? Because that's always something like, is it sort of 2 to 3 times a week? What should they be doing?
It depends upon what's going on with the patient and what's going on in the tissue. So for instance, in the US as a vet, I'm allowed to treat immediate family. So I can tell you this. My son had his wisdom teeth out, and by the time I got him from the surgical place to home, his mouth was swelling up. I lasered him twice a day for 2.5 days. The swelling was totally gone. He had absolutely no pain. He was 18. I shook him and said, "Darn it, Jamie, you're supposed to take pain meds and sleep. I have work to do." He had his tonsils out, and it was big enough that the surgical nurse said in 30 years she had never seen anything so big. And when he started to wake up, they started bleeding. He had to go back under, cauterize everything. So it was a big hot mess. I lasered from underneath, and it helped some. I had him go direct, took all the pain away. Again, from, "Oh my God, it hurts so bad, Mom," to in the evenings, he'd be like, "Mom, can you do it again?" 2.5 days of twice a day, totally done. So take that over to the dogs. If I had, say, a hemilaminectomy, I would do it twice a day, or an amputation or a thoracotomy, something that's big and painful for a couple days and then spread it out. If I have a patient come in with an osteoarthritis, I'm not going to do it twice a day. I might do it, daily for 3 days and then every other day for 5 times. But again, my rule is not to treat the textbook and give specific numbers. Have you ever seen a sine wave? I'm sure you have. My rule is that a sine wave is a goodbye wave, right? If you don't come to me until your dog is really bad, then you're not the right client for me. I want to see us get better, and then before it drops at all, go up until we plateau, and then spread everything out. And that's how we have optimum results.
Yeah, great. So treat your patient not by working from a textbook, what the recommendations are. Look at your patient, look at the tissue, work out what your goals are, and then decide from there.
And the client, I've had clients that say, "Hey, I have a bicipital tendinopathy, but I work 14 hours a day, 5 days a week. I can only come in on Saturdays." I can't tell them to come. Well, your dog's not going to get better unless you come in 3 days in a row.
Yeah.
You do the best you can with what you got.
Yeah.
That's one of my mantras.
Awesome, Laurie. I love it. So, guys, I will put the URL for that course. And you've also got like a little case study, haven't you? So
I
if you're not
do.
ready for the course yet, then you've got a case study. I'll put the URL for that too. Tell us a little about that case study and what they can expect there.
So if you sign up for the newsletter, which you don't have to see, and do I write a little bit? Of course I do. I've written book chapters, but I prefer video teaching, which has always been my best way is either live or on video. So I have video of me teaching, hey, this is what I look for in the gait analysis of this patient. This is what I look for and found on the physical exam. This is how I treated them. And then gait analysis after, so you can see the difference, what we're looking for. It's a great way to see how I teach because it's all thought out of, this is what I'm looking for, this is my goal for treating, this is how I treated it, and go from there.
Awesome, Laurie. Thank you so much for your time. It's been awesome chatting to you.
Oh, it's awesome seeing and talking to you again, Meg.
Awesome, Laurie. Have a great day. Bye.
You too. Take care. Bye-bye.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. For more information about continuing education for vet rehab therapists, you can go to onlinepetshealth.com. I'd like to thank you for listening to this podcast and, of course, thank our sponsors, Response System. They are as passionate about therapy lasers and PEMF equipment as you are about veterinary rehabilitation. They would love to answer any questions you have, so please feel free to reach out to them at responsesystems.com or you can email lisa@responsesystems.com. Vet rehabbers, for more information on how to take your career to the next level, go to www.onlinepetshealth.com. Please don't forget to subscribe to my podcast so you'll get notified. I'm here every single week talking to vet rehabbers from all over the world, learning, and I would love you to join me. Hope you have an awesome day further. Cheers for now.